Doctors Hospital is investing nearly $30 million in Grand Bahama. Phase 1 of the investment is a new state-of-the-art clinic in 8 Mile Rock. Phase 2 is a brand new private hospital in Freeport. Today, we'll be discussing details about Doctors Hospital's investment in Grand Bahama. Keep watching. This is You and Your Money.
You and Your Money is brought to you by Doctors Hospital Health System.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Welcome to You and Your Money, everyone. I'm Alexis Burrows. I'm today's guest host and the marketing director of Doctors Hospital. Here to talk about Phase 1 of Doctors Hospital's investment in Grand Bahama is Dr. Dawn Gallagher. She previously was the lead physician at the government clinic in 8 Mile Rock and is now the lead physician at our new Cavallo Medical Center in 8 Mile Rock. Welcome to the show, Dr. Gallagher.
Good morning, and thank you for having me.
We have you guys on today, and we want to talk specifically about the investment that Doctors Hospital has made in Grand Bahama. And obviously, from the clinical perspective, we want to get your expertise on, what Doctors Hospital is doing in that space. So I want to start by asking you, what are some of the current gaps in the public healthcare system within 8 Mile Rock and West Grand Bahama at large?
Actually, in West Grand Bahama, in both the public and the private setting that was here under Dr. Cavallo, one of the things that was missing was specialty care. And I'd like to extend that as for the Grand Bahama Island on the whole. Sometimes we get patients lost to follow-up because we don't have all of the specialties that are easily accessible here on the island. So the Cavallo Medical Center designed to fill that void and offer specialty services that will be integrated with our primary care. Another void here, definitely in the western area, has been lab services and definitely dialysis, and those two are the services that we'll be offering here at Cavallo Medical Center.
Can you dive in a little bit to those services, particularly lab and dialysis? You mentioned that those are some of the gaps. What does that service offering look like at the Cavallo Medical Center?
The lab services here at Cavallo is a full core lab. So we'll be able to collect and process specimen here at the facility. So the turnaround times, usually most samples have to be sent off. So the turnaround times will be same day results, or definitely within 24 hours. And with the dialysis, ideally, that benefits the community in such a way that, a lot of our patients in this area either have difficulty getting transportation up to Freeport proper. So with our services, we are also extending transportation to the people in this area. So they'll be able to get their dialysis services here, so it'll be accessible as well as affordable.
Right. So we're not just offering the care, we're also making it easier for people to actually get to the clinic and access the care directly.
Yes.
That sounds great.
I understand that that's a need for this particular community.
Right. Especially given the size and the amount of people that live in the area, right?
Yes. Correct.
Okay. So can you talk about the facility itself? I understand that it was originally the practice of Dr. Cavallo, who was a well-known physician in the 8 Mile Rock community. How has the facility been outfitted to provide the kind of quality care that people have come to expect from Doctors Hospital?
Well, he was here for decades, and he started out like myself in the public service and then moved into private practice here. And essentially what we've done is outfitted this clinic with state-of-the-art equipment, as well as well-versed staff to be able to handle all of the needs. And what we've done is we've put a special twist on it by making it more spa-esque, so that it's not just a medical visit, but instead we have the kind of ambiance here that'll kind of settle the anxiety that's usually associated with visiting your medical facilities. So between all of those and, of course, friendly, courteous staff, everybody's here to serve this community.
Right. I've had a chance to visit the clinic on a number of occasions now, and I can say it definitely gives a much different atmosphere and vibe than you would anticipate in most spaces. I've seen some of the comments on social media that refer to it as being, again, speaking to that spa element. So I'm sure, people are excited about coming into a space that's a lot more warm and inviting and not necessarily so sterile. Like, it's sterile, it's clean, but, so moving,
But beautiful.
yes, but beautiful, right. Going back to Dr. Cavallo, he served that community for 40 years. What has the hospital done? What is Cavallo Medical Center doing in order to make that transition of patients that saw him in the past, making that easier for them to transition into this new service?
Well, from the inception of this clinic, Dr. Cavallo actually walked with us hand in hand to make sure that his patients would be well taken care of. Actually, I find that since we've been open, his patients have come in and said he's actually kept in touch with some of them through phone calls and encouraging them to come and follow up with their routine visits. So what we've done is that we've held on to his records, and we actually went through them and reached out to his patients to let them know that, this is by no means the end of the Cavallo area, but more of a continuation, so that we, reassured them that definitely their records would be available. And of course, we've taken it up a notch by offering premier services that he was not necessarily able to provide at the time.
Right. And I think that's something that we've tried to intimate as much as we can as we've gone through the promotion of the clinic, is that this is in no way a disconnect, but a continuation of the legacy of Cavallo, which obviously speaks to how we named the clinic in the Doctors Hospital space, right? Recognizing and honoring his contribution and naming the clinic after him. Getting into some of the nitty-gritty, people listen to you come on the shows, and one of the things they want to know, okay, how do I access it? What are the operating hours? Do I require an appointment? How do I get into the clinic space if I needed to get an appointment?
Ideally, you can come into the clinic and make appointments. The registration staff is really well versed with being able to sort out, sign up for NHI, as well as trying to make sure that they gather all of the information beforehand, so that when you actually come for your appointment, you don't have to spend time doing that. But we prefer appointment services because then it minimizes those wait times. Right. But we also have walk-ins, and so that you're able to do that as well. And then, of course, you could come for your primary care services, which include like your immunizations, your physicals, school medicals, as well as management of the chronic conditions, diabetes and hypertension being the most common ones. And then, of course, your day-to-day ailments like your coughs and colds, aches and pains, and of course, minor lacerations and things of those nature.
Right. And the clinic is open from when to when?
The clinic is open Monday through Friday from 8 to 4 for now.
All right. Thank you for joining the show today, Dr. Gallagher. A lot of really good information for the community there in 8 Mile Rock, and we were happy to have you on the show.
Thank you, and have a nice day.
All right, you too. You're watching You and Your Money. We'll be right back.
Doctors Hospital's Pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now. 3 advanced facilities at Collins Avenue, Carmichael Road in Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Doctors Hospital is pleased to announce our ambulatory surgical center located at Centerville Medical Center, number 68 Collins Avenue. This state-of-the-art facility offers outpatient same-day surgical services. Our team of skilled and attentive nurses, technicians, and administrative staff are ready to serve you and provide the highest quality care while offering competitive pricing in outpatient surgeries. Patient benefits include online pre-registration, pre-surgical screening, and anesthesia evaluation and clearance, all in a safe, COVID-free environment. We're open Monday to Saturday from 7 a.m. to 7 p.m. If you have questions, feel free to contact us by phone at 302-3260 or by email at surgerycenter@doctorshosp.com. Doctors Hospital, trusted and best care now. Isn't your health worth it? Welcome back to You and Your Money. If you're just now tuning in, I'm Alexis Burrows, the guest host for today's show. I'm also the marketing director of Doctors Hospital. Today, we're talking about Doctors Hospital's investment in Grand Bahama. Before the break, we spoke about Phase 1, the opening of our new Kavala Medical Center in 8 Mile Rock. Joining us now to discuss Phase 2, our flagship investment, is Kendra Stirrup, Director of Finance and Operations at Doctors Hospital Grand Bahama. Welcome to the show, Kendra.
Hi, Alexis. Pleasure to be here.
Our flagship investment is the new hospital in Freeport. Can you talk about the hospital, Kendra? Where is it going to be located? And what can Grand Bahamians expect from a Doctors Hospital facility in Grand Bahama?
So if you're familiar with Grand Bahama, the former First Commercial Center, which housed the CIBC Bank in the heart of Freeport, is where we have planned for our hospital, Doctors Hospital, to launch our investment of our inpatient facility here in Grand Bahama. The hospital was donated so generously to us, the building itself, by Mr. Kemp Rockwell, and Doctors Hospital, through our president and CEO, Dr. Charles Diggins, along with the executive board, has graciously put in another 20-some million towards investing in that building to be able to outfit it with all of the bells and whistles of what an inpatient and outpatient facility should be.
Right. So what kind of technology can we expect in that space? What are some of the services that are going to be offered in the hospital once it goes live?
So the hospital is a 30-bed facility. It has all types of high technology. So we have the pleasure of building this from the ground up, which is a very nice twist where you're able to put in the high end of technology. Our imaging suite includes our CT, MRI, mammo, ultrasound, and all of the bells and whistles of what's required for that special area of diagnostics. We also have up to the ICU level care of beds. We have a cath lab that will be able to do interventional cardiology. Very nice outfitted space in that area. We'll also be able to take patients for inpatient dialysis as well as outpatient dialysis in that site. We have a full emergency room. In the emergency room, which is unique about this space, is that we will be bringing in all of the technology as what you would see on an ICU level, where you'll be able to intubate, ventilate a patient, airlift out, if that is the patient and relative's desire, without ever having to be admitted to the floor. So we're definitely giving a lot of attention to detail from our experience with Trusted and Best Care now in New Providence and bringing that here to Grand Bahama.
So what it sounds like, what it's going to be is a full-service hospital facility, inpatient with some outpatient services as well.
Yes, in addition to other outpatient, as we said, so pharmacy, dialysis, specialist clinic will also be at that facility as well.
When can people expect this facility to be open? What is our launch window looking like?
So we're just completing with demolition, which is very exciting. We're wrapping up, as I mentioned, it was a bank prior to, so we're about 95% complete. What we're struggling with, of course, is getting those much reinforced vaults out of the building. And we're just near completion with that. Once we have done wrapping up that, we move to conclude our design, which is led by the Architects Incorporated, Mr. Donald Dean, who's done a very tremendous job with getting us to the stage that we are at now. So we are about to cross that border where we will begin to look to contractors to be able to build this building for us, build in some new additional supporting buildings as well to complement the services that we have. And we hope that by next year's summer, the only thing pending would be lead times for equipment and construction supplies, as we are aware are challenged in this time. But by next year's summer, we do hope to have the hospital open and ready for Grand Bahama.
What kind of impact do you anticipate the hospital having on the local economy in Grand Bahama?
Grand Bahama has been deserving of a hospital for so long.
Mm-hmm.
We've been promised a hospital, and we know that the powers that be have been pushing to get this up off the ground. But of course, challenges year after year. Hurricanes has been plaguing this island, as well as the pandemic, and so it's been challenging.
Mm-hmm.
And so it's very exciting to be able to be the one that's groundbreaking to bring an inpatient facility for Grand Bahama.
Right.
One of the most frequent questions that investors typically have is, do you have an airport? Do you have a hospital? And so now we're able to check off that we have a hospital, a private facility, to be able to give both investors and locals an option on the island as to which care choice of provider they would choose to seek.
Are there any other top secret plans that we need to be aware of? We talked about the hospital, we talked about Kavala. Is there anything else you want to give the people as to what's happening in Grand Bahama that they can expect very soon?
We're always at it. We're always at the investment table.
Mm-hmm.
And so what we do have coming up in Freeport, actually, within about a month, we are launching our outpatient clinic space in Freeport.
Mm-hmm.
If you're familiar with just where the kidney center is, directly across from that building, we'll be putting in a specialist clinic led by Dr. Mescles, who is our cardiologist. And so he will be coming in to do interventional cardiology clinic, as well as EKG, ECGs. And we also have that space as a lab collection site. So you don't have to come up to KMC, to Kavala Medical Center in 8 Mile Rock to have your bloods drawn. But if you're in Freeport, you can have those done there. We will still process them right here on island in 8 Mile Rock. Then, of course, we have a pharmacy in that facility as well, where we'll be offering specialty meds. And those are not just specialty meds that are self-administered, but specialty meds that are nurse-administered. And so we hope to continue to bring effective impact now. We know that a hospital will take some time to put all of the concrete and so forth together to get it up and running.
Right.
But we know that healthcare is needed now. And so this is one of the things that we have stepped forward to pull in our plans so that we are able to provide the service on island.
I'm sure that's a lot for our viewers to digest. So Kendra, we need to take a quick break, but we have a lot more to discuss when we come back. This is You and Your Money. We'll be right back.
Whether you're battling a chronic condition or offsetting a new injury, Doctors Hospital's comprehensive rehab services offer the help you need now.
Go to doctors.
3 advanced facilities at Collins Avenue, Carmichael Road, and Cable Beach means your personalized plan for care is just a visit away. From physiotherapy to occupational therapy and speech and language pathology, our team approach is all about rebuilding together. For a full list of services, visit doctorshosp.com/rehabilitation. Doctors Hospital, trusted and best care now. Isn't your health worth it?
Doctors Hospital's pharmacy introduces a new spin on prescriptions called Pick Up Now, Pay Later. That's right, you can collect your medications first and pay after. How does it work? Step 1, submit a prescription online. Step 2, select the pickup site. Step 3, collect your medication. And Step 4, pay online within 14 days. For more info, call us at 242-302-4785 or visit us at doctorshosp.com.
At Doctors Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free Prime Care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off labs, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctors Hospital, trusted and best care now.
Welcome back to You and Your Money. I'm Alexis Burrows, today's guest host. Still with me is Kendra Stirrup, Director of Finance and Operations at Doctors Hospital, Grand Bahama. Kendra, we're going to pick up our conversation where we left off and kind of move into, that affordability, accessibility space, because I'm sure that's questions that a lot of our viewers have, especially those in 8 Mile Rock and in Grand Bahama. How are we making the cost of medical care and our services more affordable to those residents?
as a part of our Trusted Invest Care now, one of the things that we are is we are community minded. We do acknowledge that the economy of Grand Bahama needs a boost. And of course, it would not make sense to have such a pretty facility without persons being able to access that facility.
Right.
So we have several different mechanisms that we have in place. One being our primary forerunner, which is LAMP, the Loyalty Advantage Membership Program. And in that program, we have several different tiers, one being for insurance, persons who have insurance to supplement their insurance plan. And then also the second being for those who do not have insurance, that we have a primary care built-in package for you. And so both plans, what it does is gives you a very low membership fee that is paid monthly. However, it gives you unlimited access to your primary care physician.
Right.
So you can come and see Dr. Gallagher anytime you wish, and we'll be happy to see you at no additional cost. That also covers in your annuals, it covers your labs. So there's no out-of-pocket fee for your labs when you do have either the LAMP supplement for insurance or the LAMP primary care for persons who are self-paid.
Right.
Now, if you don't have LAMP, which we want every patient to be a member of LAMP, but if you don't have LAMP, we still do have options at affordable rates to see the physician. And that is as low as $70. You can come and see the physician, have a consult, see what's going on with you. That's for any scratches, bruises, bumps, any issues you have going on that are non-emergent. And of course, if you do not have that $70, we're still here to work with you. And we're able to offer payment plans to you to be able to have you pay that fee over a period of time, but not prevent you from having the service of medical care to you.
Right, because ultimately the idea is we want people to be able to access the services more than anything else.
Yes, most definitely.
And speaking to access, I know one of the things that your team is feverishly working on is NHI enrollment and gaining people access to the care via NHI. So how can Grand Bahamians who are enrolled in NHI access services at KMC?
NHI affords any Bahamian who has an NIB card to be able to register to receive services at no cost. There's no membership fee. It's something that the government has invested heavily in, and something that really affords the public the opportunity to have no excuse to see a physician and do how conversations on your planned care options. And so with NHI, we have several options that are open now. We're still onboarding with NHI. However, we are still accepting persons at a pre-registration level. So if you're interested in registering under Doctors Hospital Grand Bahama NHI, you can just call the Kabbalah Medical Center at 688-6002, or you can send an email to kabbalah@doctorshosp.com. And we are able to take your information from you, have you pre-registered in our system, and still be able to see you with all of the NHI benefits. Of course, once our NHI is formally enrolled, which we expect to be in another month, you are able to also contact NHI, make the selection of Dr. Gallagher, and you're able to register to have those services for free here in East Monroe.
So the investment in Grand Bahama is a part of an overall initiative from Doctors Hospital called the EAGLE Initiative. Can you share briefly what that is and its significance in improving healthcare delivery in the Bahamas?
Yes. So what I love about the EAGLE Initiative is the G sits right in the middle. That's Grand Bahama. So Grand Bahama is the queen of EAGLE Initiative. Please don't tell any of our colleagues about that comment. But here in Grand Bahama, we have the pleasure of not just sitting in the Grand Bahama aspect of EAGLE, but we also have Abaco. And so we are the northern region of Doctors Hospital, and by extension also Bimini. So we do have plans to be able to bring healthcare to all of our family islands in the northern Bahamas, whether that is through referrals here to Grand Bahama, where you don't have to travel all the way to the capital to receive those services. You may have relatives already here in Grand Bahama, which makes your healthcare journey even more accessible and affordable for you. And then also we want to make sure that we listen to those islands as well as it relates to what services on those islands you specifically need to have on island.
Right.
We're here to listen to those comments and to be able to take feedback on that and develop our EAGLE Initiative for Grand Bahama Abaco, by extension for Bimini. Of course, we do have other islands that are included in that initiative. And so one of the things that our president and CEO has been focusing on is listening to the concerns of the citizens for the Commonwealth of the Bahamas. Doctors Hospital is the only private healthcare facility in the Bahamas. And so our responsibility as a corporate citizen and as a social aware citizen is to be able to make healthcare accessible, affordable, and to be able to provide it at a quality standard that we are accustomed to here at Doctors Hospital.
You know, and I think that speaks to, you know, a lot of the effort that we've put into this. Even in Grand Bahama, we had done focus groups and things like that, and we're looking to do a lot of the same as we prepare to move into some of the other islands within that Eagle initiative. Thank you so much for all this wonderful information today, Kendra. We were happy to have you on the show, glad to have you here. Any parting words?
Thank you, Alexis. No, I just want to share that we are excited in Grand Bahama. Should you have any questions, please feel free to reach out to us. I will also share my contact, 804-4542, and I'm happy to hear any concerns or questions that we can use to be able to develop our program here in Grand Bahama even more efficiently.
All right. Thank you, Kendra. It has been a pleasure hosting today's show. Don't forget to follow You and Your Money on social media and tune in next week for another exciting episode. Thanks for watching.